Miscarriage is the loss of pregnancy during the first 23 weeks. And the most common sign of miscarriage is vaginal bleeding, though most women mistake it with a spotting. So, but there are difference between spotting and when you are having a vaginal bleeding due to miscarriage. Then another sign that you see to know that you're having miscarriage is cramping or pain, especially in the lower abdomen. Then a discharge from your vagina, fluid discharge from your vagina is also a sign that you're having miscarriage. And then tissue discharge. Sometimes some women will start seeing something like meat, tissue discharge from your vagina. It's also a sign that you're having miscarriage. Then to some women, they no longer feel the symptoms of pregnancy. If you are within your first trimester and you started feeling nausea, vomiting, tiredness, and all that, and all of a sudden you're no longer feeling those symptoms of pregnancy, that means you're having miscarriage, or all of a sudden you are no longer feeling sick, there is no longer breast tenderness. That is to show you're already having a miscarriage. And for some women, they will have this miscarriage without realizing, because most time this miscarriage occur at the first trimester, at the period when a woman is expecting her menstruation. And when the miscarriage is happening, they usually think it is their menstruation without knowing that it is really it is a miscarriage. Now, the causes of miscarriage, the causes are unknown, but most time chromosome problem result to miscarriage when there is problem with the chromosomes that form that baby. Maybe the number of chromosomes are in excess, or they are not up to the number is supposed to be 46 chromosomes to make up the fetus. And once your body realize or find out that there is a missing chromosomes or there is a too much, your body has a way of terminating that pregnancy, because there is already a problem with the chromosome that form that fetus. Then sometimes placental problem would make one to lose her pregnancy, in the sense that placenta helps to supply oxygen and nutrient to the fetus. And now when there is problem with the placenta, your body has a way of terminating such pregnancy. But aside these two causes, there are some other causes that you can say contributing factor or risk factor that can predispose you or predispose someone to having miscarriage. And one of these factors are age. Women in their advanced age and getting pregnancy for the first time, most of them have this issue of chromosome problem, and their baby usually comes up with abnormality, and their body has to do away with that pregnancy. So this is why most women, advanced women, always have problem with miscarriage. Then smoking or use of drug, alcohol, or intake of too much caffeine, all these things can predispose a woman to having miscarriage. And then when it comes to medication we take, especially if you are trying to conceive and you are feeling sick at any point in time, please don't go and start using anti-malaria. It will make you to have miscarriage without you realizing that you are pregnant already. This is why, especially those trying to conceive, if you are feeling sick at any time, please consult your doctor first, or go and get a pregnancy strip. Have a pregnancy test first to rule out pregnancy before you go and take whatever medication you want to take, because some of this medication will make you to have miscarriage without you knowing that you are pregnant already. Another factor that can predispose a woman to having miscarriage is when a woman is overweight or obese. It can make you to have miscarriage. That's why it is important that if you are trying to conceive, make sure that your weight is within the normal BMI. If you are not overweight, you are not underweight, so that your body can be able to maintain that pregnancy. And if you are the type that usually like taking alcohol, you might consider reducing alcoholic intake. Then some infection can also predispose one to having miscarriage, and food poisoning. It's important that whatever you are eating, make sure of whatever you are eating, especially if you are trying to conceive. Please be careful with your body. Be careful with what goes into your stomach, because some of these things might, the food poisoning might cause you to have miscarriage. Then infection and some virus infection can also cause miscarriage. So please, if you are trying to conceive and you feel like you are having infection, please do well to treat yourself before going ahead to try for baby, so that you don't get pregnant and infection cause you to lose that pregnancy. Another factor that can cause this miscarriage is uncontrolled diabetes. When you're having uncontrolled diabetes, it can make you to lose your pregnancy. It can make one uncontrolled diabetes can make one to lose their pregnancy. So please do well to always check your blood sugar level, especially if you're having recurrent miscarriage. Try to check your sugar level, because if your sugar level is high and you're not doing anything to control it, this is why you keep on having recurrent of miscarriage without realizing where it's coming from. It's not village people. Please, village people have really suffered. So sometimes it's not really village people. It could be a little problem that you could take care of, but because you didn't know, it keep on happening and we keep on blaming village people. So make sure, if you're trying to conceive especially, make sure you have a holistic health check to be sure that everything is okay with you and nothing can cause this. Some of these factors might not bring up miscarriage for you. High blood pressure can also cause one to have miscarriage, or some heart condition and some kidney problem. All these things can cause miscarriage, and most time we neglect some of these things, especially this diabetes. We neglect it without knowing that it can cause us to have miscarriage. Then in the second trimester, some women also go on to have miscarriage due to weak service. When their service is weak, maybe from previous surgery, and have weak service, and this weak service will make them to have miscarriage, because during pregnancy your service is supposed to be closed, so that the pregnancy can grow and sustain. But once your cervix start to open, then the fetus will see a passage to go through, and the time have not yet come, and this is miscarriage. So if you're having weak cervix, it can cause a miscarriage. So treatment of miscarriage depends on why you are having the miscarriage. If it's due to obesity, the treatment is simple. You go on a healthy diet, maintain your weight. If it is due to diabetes, you already know you control the diabetes by what you eat as well, and try to exercise, not strenuous exercise, but try to be fit and active every day. It will really help you.